Hello, everybody. Welcome to Cairo Secure Show, Look to the Children. I am your host today, I'm Dr. Monica Berger, and I am pumped up to share with you our first in series. I'm thinking we're going to do like a maybe 5 or 6 week series on understanding primitive reflexes. So today we are going to just start with the foundations of what these little puppies are. Unfortunately, Elizabeth is napping at this time, so she can't be live with us, but she does say hello to everybody, and hopefully you're all doing well. So, with that said, we are going to rock and roll to our slideshow and have some fun. Again, first of all, as always, Cairo Secure has been such a phenomenal part of our profession and has really been first on the forefront of supporting us. So thank you, Cairo Secure, for giving us this platform and being able to share our message with the world. So, what are primitive reflexes? Okay, here's the dealy wop. What happens um, in utero, first of all, the way these guys form is the experience of the little fiddle fart in utero causes synapses to form. These are primitive in nature. That's why we call them primitive reflexes. They're brainstem oriented, they're automatic, they don't have cortical involvement, and they should have a limited lifespan. Provided that that little fiddle fart gets the right experience in their environment when they are in the postnatal life. Okay, so these synapses form in utero, and what happens is we should have this experience. An example, in utero, it's anti gravity. Little fiddle farts born, they should have the experience, they will have the experience of gravity on their nervous system. They should be experiencing these things in tummy time and these different milestones, which we're going to actually titrate that message into our series because the CDC just came out in the past week or so and they have altered the milestones. For instance, language acquisition speech has been pushed further, um, more not at 2 years of age, but beyond that, 2.5 years of age. Crawling has been pushed from, or walking has been pushed from 12 months to 18 months. But we're going to talk about those. Is that right or wrong? We're going to bring those in next month. Anyhow, so we should have these experiences, these milestones, and it creates a sensory experiences. And those synapses that were formed in utero are broken, and stronger, higher, more sophisticated synapses are formed. So I like to use this analogy that primitive reflexes are like the roots of the nervous system. You see this tree here. They're like the roots of the nervous system. They're always part of our neurological system, but by the age of about 1 year, they should no longer be active. Um, they should be below grass level. So I like to use this picture, this graphic here. They are the roots. We now go on to use more higher sophisticated centers of the brain. So, causes for poor integration. We used to use the term integration. We have switched that more to persistent active reflexes. They stay active when we have stress, when there are stressors of the mom during pregnancy. Now, I've done several classes over the last decade, but especially over the last 2 years on prenatal stress as the neurobiology of disease. And this is what we know from the current neurodevelopmental paradigm. So, pregnancy stressors can cause these persistent active reflexes. Um, Lack of proper movement experiences, environmental experiences, sensory experiences postnatally, lack of tummy time, um, illnesses, trauma, chronic stressors, you name it. Any stressors on the system can pull, um, can keep those reflexes active. Tongue tie, lip tie, okay, tethered oral restrictions. So some some look at these persistent reflexes as dysmaturation of higher inhibitory pathways. Okay, lack of myelination of higher, more sophisticated centers like the prefrontal cortex. There is a hierarchy, an order in which these reflexes do integrate or should become less active. The fear paralysis reflex is actually one that should um, disappear in utero about 11 weeks of gestation. That gives rise to the Moro reflex. Again, if mom is in a chronic stress mode during pregnancy, the prenatal stress factor, this reflex often doesn't integrate, it stays active, and Moro really doesn't take over. So as we go down the hierarchy, Palmer and Rooting, they disengage, they integrate or become less active 3 to 4 months. Moro can take 2 to 4 months. Tonic labyrinthine, there's a flexion component of that and an extension component. Again, what I'd like to do is take the next 5 months or so, 5 series of these shows, and hone in specifically on these specific reflexes, what to look for, what do they mean. The Palmer and Rooting reflex, for example, is going to foster, if it's integrated, if it's disengaged, it's going to foster maturation of the tactile and proprioceptive sensory systems. So all of these reflexes represent the maturation of our sensory motor systems. This is really an important thing that we need to understand. If these guys stay active, it's going to pull down maturation of our sensory motor systems. Moro, for example, Moro represents all sensory systems. All of our sensory systems, our external sensory systems and our internal. So not just sight, smell, sound, taste, touch, but our internal awareness, our microbiome, our immune system. Again, if those things are dysregulated, if we have stressors on those systems, these reflexes are going to stay persistently active. And this is so important given the last 2 years of what we've been dealing with. So here's the deal. Integration of these reflexes allows us to move through our spatial world as we go through the developmental stages of life. So on this hierarchy here, we have primitive reflexes. Again, those are the first we like to see disengaged, no longer active at 12 months or later than that. If that happens, then we get postural reflexes. Those reflexes we want active. We want these to mature. This is our sensory motor development. This is our postural stability. And we've done little workshops here on ChiroSecure and past classes, past shows about postural stability. And the fact that postural stability is one of the number one things recognized that is associated, postural instability, I should say, is associated with a number of neurological disorders or developmental disorders or labels. ADD, ADHD, autism is huge here, schizophrenia, dyslexia, Tourette syndrome. They all have within them a known issue with postural stability. So if we don't get those primitive reflexes to integrate, we have potholes in development, difficulty reaching postural stability, and then we go to fine motor control. We have to have gross motor control before fine motor control. So our handwriting, our visual tracking, our ocular motor function. So what I want you to take away from here before we go on in the next classes is looking at the stressors. Sometimes we try to work the tip of the iceberg where we just want to give exercises for those primitive reflexes. This can frustrate the little fiddle farts, frustrate you, frustrate the parents, because under times of stress, these reflexes can reemerge or reactivate. So we've got to ultimately look at what stressors are pulling down the system, especially with the last 2 years and all the prenatal stressors. So I want you to start looking at taking a red flag history of looking at how to eliminate some of those stressors off the system before you dive in and say, let's just give this exercise for this reflex. You might do them in tandem if the little fiddle fart is able to handle that without neurological overwhelm. But look at these stressors, our trauma, our micro, macro, emotional, mental trauma, what toxic environment. If the little fiddle fart didn't have a lot of movement in utero, if there was a utero constraint, if they were a breach, these primitive reflexes, these synapses form by that little fiddle fart moving in utero, kicking, the sounds they experience, mom's heartbeat, external sounds. These are all forming sensory input, forming those initial reflex synapses. If we've got these loads on them, what are the thoughts of mom, of dad, of the caregivers? Technology, we're getting study after study on technology especially in the early years, and how it is hampering neurological development. So again, you try to tackle those primitive reflexes and you don't tackle the roots of what's holding them up, you can have a negative effect there. Tethered restrictions, tongue tie, lip tie, subluxations, anything that is restricting biomechanical movement, fascial restrictions, lack of awareness from the body to the brain. And then the terrain they're growing up in, the external environment, their internal environment, their microbiome, are they colicky, etc. Okay, so the biggest takeaway from today is understanding that these primitive reflexes are going to form via synapses from the experience in utero. That experience is different than postnatally. So we need a proper postnatal sensory environmental experience to break those primitive reflexes and form higher, more sophisticated neurological structures. If any of these 6 T's are interfering with the nervous system's ability to do so, you need to dig into those and clear that slate. And then either at the same time or once some of the load is taken off the system, then tackle those primitive reflexes. Get those to integrate, get your postural reflexes on board, and then your fine motor. So again, today I just wanted to dig into the foundations and let you stew on that a little bit. And then we'll take this a step further next month when we tackle in integration order those individual reflexes. So until next time, again, Kairos Secure, you're amazing. Thank you, everybody out there. Keep changing lives. Keep up the great work. Now more than ever, those little fiddle farts on those families need you. And join Eric Kowalski next, the first Thursday of next month, and I'll be back the third Thursday of next month.
Today's pediatrics show, Look to the Children, was brought to you by Kairos Secure.